Good morning to you, Plain, and also to your viewers.
So talk to us. It's an important visit.
We're coming to you
Go
live
ahead. Yes.
We're at the Eastern Cape. Okay. We're coming to you live from the Livingston Hospital, one of the hospitals out of 20 hospitals in the province that have been designated to deal with the COVID-19 virus. But now we're coming to you live inside the venue where the Eastern Cape Provincial Government will be doing a presentation about the step that it has taken to mitigate the spread of coronavirus in the province. I think the visit by the President followed that last night's speech where he announced that the country will probably be going, at the end of the month, will be going to level 3. But warned that not each and every province in the country and also district will be going to level 3. Some of the district and also provinces will remain under level 4, and I assume that the Eastern Cape and the Nelson Mandela Metro, which is the epicenter of this virus in the province, will also remain under that level 4 under strict condition. But there's been a lot of number of contributing factors to the spread of this virus in the province, such as the social gathering of funerals and also cultural activities, including also people not adhering to the lockdown regulations. But just now, the Premier of the Eastern Cape Province, Oscar Mabuyane, will be joining me just to talk about more about this presentation that we'll be doing with the President. Premier, thank you so much for your time. Am I correct to say that probably the Eastern Cape is one of those provinces that will not be going to level, that will remain to level 4?
That's a serious speculation, but I think where we are, we should be able to be content with the challenges that we are still going through, numbers surging, etc. It's really not an issue of levels, but it's an issue of how do we contain the virus, how do we sustain the kind of an economic recovery plans that we are putting in place. But of course, you can't risk life comes first. This has been a campaign of saving lives. It has been a campaign of investing in humanity. So it's important that we always balance those kind of issues that are at our disposal. So we are working around that, and come end of the month, and with the fluctuation on numbers that we are seeing daily, the real-time data that we are working on. Yesterday we had about 30 from 180 something. The numbers have been doing that, but because we are going all out to detect the virus, to make it a point that we disrupt it's actually a transmission amongst these people, getting our people observing regulations, getting our people obeying the law. It will also help us. Remember, the risky or challenging situation about Eastern Cape is that the two hotspots are also our industrial hubs. So if you talk about business getting back to normal and life going back to normal, economic recovery plan, you can't talk economic development in the Eastern Cape without talking Nelson Mandela, without talking Buffalo City. This is where you have got also our very developed SEZs, the work that has been happening here. So it's a very difficult situation that we are in. We've got to arrest this, we've got to stop it, particularly in Nelson Mandela as well as in Buffalo City. I know even in other rural areas it is also going on and on. But with our plans that are in place, working with national, I'm actually quite optimistic that we will be able to nail it in the bud.
But what has caused these numbers to fluctuate, especially the daily infections? Sometimes they are high, sometimes you find that it's a low number. What is, when you are looking in the reports that you are receiving, what has caused that?
It's a massive testing that we're doing, but key at that is an issue of the movement of our people. As we all know that the virus moves with people as they move, but funerals. I think the problem, the corridor we have, the relationship we have with the Western Cape, as people die in Western Cape in numbers, they get buried in the Eastern Cape. So we're picking up those issues. Every funeral is becoming a hotspot as I'm talking to you. And some of those cases are COVID-19 positive cases from Western Cape that are being buried here. So we are getting into that now. We must manage what is being actually imported into our situation. We must manage what we are trying to, we're working with the national strategy that is actually kind of target specific in terms of communities. But now we have got all these other factors that are coming from outside trying to also encroach our space. But we're working on that. We can't deny those people access to this province. They are people of this province. They are coming here. Now it's getting into winter. They're staying in informal settlement in Western Cape. If in situations like this, the health condition, they must come back to their homes. So that's a situation that you've got to understand. But how you manage that so that we are also not exposing and then making everyone, you know the levels of susceptibility of our people here, the issues of comorbidities of our people in this space, and all those kind of medical conditions that are in place, they make it quite risky, and we have said so, the kind of conditions, the social conditions of our people in the province. We also have challenges of our medical kind of healthcare systems. If you look at best doctors that you can find in the Western Cape, you can't easily find them in the Eastern Cape. Yes, there are doctors who are so patriotic, dedicated, but generally the kind of healthcare facilities that you'd want to have. That's why we're looking forward to NHI, because we thought that it will be bringing all these opportunities to the areas like Eastern Cape that are still going through the process of development.
There's been a lot of a game playing between the Eastern Cape and also the Western Cape, saying that these new cases are coming from the Eastern Cape. The Western Cape saying, no, the Eastern Cape is just accusing us. How did the province of the Eastern Cape arrive to that decision and say, look, these cases are actually coming from the Western Cape?
That doesn't really need a rocket scientist, but I don't think it's a question of a blame game. It's a question of facts, as we try to seek the truth from facts. Having done the kind of testing and screening that we're doing on our cross-border entrance, you look at your Aberdeen numbers that we have managed to pick up there in Aberdeen. Remember, we didn't pick up everyone, but those people were coming in. That should give you a better sampling that most people who are coming from the hotspots areas in Western Cape, getting into our communities, they have this kind of a direct impact on how these numbers are growing. We managed to detect some, we managed to quarantine, we managed to isolate some, but even others, they come in here, when you test them and the results comes out, they're back in Western Cape. So you've got that kind of a movement of this virus between these two provinces, which is a risky to both provinces. That's why we have met with the Premier, Alan Winde, and his team, try to say how best are we having a collective and a collaborative approach to arrest this problem. It's not a political issue. It can't be a health issue. It's a humanity issue. We've got to save lives. So our attitude is about that. But at least the point that we're taking about Western Cape was more on farmers. That farmers who could have taken more responsibility about the 10,000 people that they had during a season, harvesting season there, that they should have not thrown those people out and just make them to go home like that without even testing them, looking at them, their health condition, knowing that they are coming to the vulnerable people in their homes. Because these people are in Western Cape because they are looking for greener pasture, they are looking for opportunity. They are not there to be exploited. So I think the point was around that. So between us and government officers, there's nothing because we all understand this issue. But the concern we had was the posture of them appearing to be protective on people who have done wrong. So the wrongdoing must be condemned, and it must be condemned by all of us.
Just last on aside, in one of the briefings after the executive council meeting that you had, you expressed a concern that if there's a surge in these numbers, especially if we reach that 1,000 mark, you are concerned about our health system. Does it have enough capacity to deal with this COVID-19? I know the province the last time had set aside 2,000 beds, and now we're currently bubbling around 1.4 cases. Does our health system have enough capacity to deal with these cases of COVID-19?
Definitely, yes, we will be able to handle that, looking at our plans of establishing the field hospitals. We're talking about a field hospital that has been donated by Volkswagen that will accommodate about 4,000 here in Nelson Mandela, additional to the current existing beds in our public facilities, as well as the private facilities that we have actually secured. But also you're looking at our plan across the province, where we are targeting about 500 beds additional per district on our field hospital. But what we have said, make those field hospitals not to be something of coronavirus, make them to be something that will be able to help us on a legacy building up towards 2026 NHI program.
Okay, thank you so much. That was the Eastern Cape Province, Oscar Mabuyane, just talking about some of the steps that have taken to mitigate this coronavirus in the province. I think we're just an hour away from the arrival of the president, but on my side with my colleague SABC and the rest of the team that has been bringing you this quality picture and also sound back to you in studio.
Team Eastern Cape, thank you very much indeed. We will go back to them in a short while when that briefing kicks off. Thank you very much indeed for your reporting, Ben.